PACU shift recap. I didn't get home until midnight last night, so I'm filming this morning. Started my shift at 3 o'clock, and I started with a post-cardiac cath patient. So this patient went to the cath lab. They went in to take a look at their arteries and their heart. This patient had multi-vessel disease, which means that they did not get a stent. They have to be referred to cardiothoracic surgery for a potential CABG or open heart surgery. So because it was only diagnostic, I just had to keep them for an hour, monitor, and then take the TR band, which is a band that inflates with air that holds pressure on the access site. So around 4 o'clock, I started removing the air from that TR band. You take out 1 to 2 cc's of air every 5 minutes or so and make sure it doesn't start bleeding. Once that band comes off completely and the patient is stable, then you can call report. This patient happened to come from a room already, so I brought them back to their room and I handed off care to their nurse. At 5:45, I came back to the PACU. I finished my charting, I cleaned up my bay, and then I went to lunch. Our lunch breaks are an hour long, so I went to the cafeteria, enjoyed my lunch, and then came back at 1900 or 7 p.m. And this is when things got a little bit busy. I took over a patient that had already come out of the OR. They were not doing well. This patient actually ended up decompensating pretty bad, so anesthesia came to the bedside. They re-intubated them. And so when I took over, the patient had just been intubated. So we were just trying to settle the patient, get the patient on sedation. The patient only had 1 peripheral IV, so we had to do an ultrasound guided second IV. Then I called report to the ICU where the patient was going, and I was able to give report to the ICU and bring the patient up to the ICU. So from about 7 to 8:20, this was all going on. It was kind of chaos, but then around 8:20, we were able to hand off the patient in the ICU. Came back down to the PACU around 8:45, and this is when we decided collectively as a shift that we needed to order ice cream. So we put a DoorDash in order for ice cream. At this point, the department was more or less clearing out. So we were cleaning up the bays, helping around, making sure everybody was squared away. And then around 10:15, we got a hernia repair pre-op from the ER. So because a lot of nurses now didn't have patients, we all kind of swarm. We prep the patient really quickly together, like within 15 minutes, and the OR team comes out and takes the patient into the OR. 2300 is change of shift. So night shift comes on. We hand off whatever patients are left. After report is done, go grab my stuff out of the locker room, clock out, and go home. This was a Sunday. There weren't that many patients. We had a couple really sick patients, but overall, it was a great day in the PACU, like every day.